We need to wake up.
The problem is very urgent.
It's really an epidemic, no question about that.
70% of the global deaths are due to non-communicable diseases.
So those are the diseases such as diabetes, cancer, coronary heart diseases that are not transmitted through a bacteria or a virus.
The causes are related to four major areas: diet, alcohol, tobacco, or it could be the environment, air pollution.
NCDs represent the most important public health challenge of this century.
Walk to talk is a possibility for people to walk or to run, and basically an opportunity for physical activity. But it's actually much more than that. It's sending a very strong message about the big epidemic we have in the world around NCDs. And what is really, really important is that it's not just about talking, it's about taking actions.
We need more action, we need more social mobilization to create a fair environment in which the healthy choice is the easy choice.
So, how do we set the trends? How do we change what people are doing and not doing? How can we support people to make more healthy choices?
Diet, physical inactivity, alcohol addiction, all of them actually affect mental health. So we have to tackle all of these together.
Changing behaviors is not that easy.
We cannot blame an individual because we live within a system.
Policies are absolutely critical to influence every determinant of NCDs.
Let's talk about taxation. It's a highly effective policy. We have really good examples of that in the case of tobacco and also in the case of sugary beverages.
You need a combination of actions, policy from government, but you need also industry to provide the right kind of products for people to be able to make healthy choices.
If industry really want to be part of the solution, they should stop fighting against what works. We should be able to create a better system that's good for everyone.
We need different people within different sectors in society to be engaged. And we need people designing cities and local environments so that people actually can walk, can bike, can have access to playgrounds. You need to ensure that people have the resources.
Health is a human rights issue, an end in itself, but it's also a means to development.
People all across the world have realized that NCDs are a major threat to development. There's been a sea change. Now NCDs are on the agenda.
I think we are much more aware in identifying where the problem is.
The problems we have with non-communicable diseases cannot be tackled by the health sector alone. And that's why we're calling for multi-sectoral approach.
It's actually the people in other sectors that are going to make the difference.
It's important to assemble all the agents of change: government, civil society, academia, the private sector, and get them all to work together. Then we have a recipe for success.